Good afternoon. Thank you for watching our live update for Tuesday, December 1st. I'm going to share with you some news about our COVID situation. Then Bev Beck from the Employee Christmas Fund Committee has some information for you. Whitney from Recreation has some information, and then David Curtis has our pastoral care segment. So from the COVID-19 situation, we have some good news that I'd like to share. We also have some ongoing challenges, which I'll also share with you. First, for the good news, all but 2 of the households in Parsons Health Center are now able to come out of isolation. What this means is that on all but 2 of the hallways, staff are no longer required to don and doff full personal protective equipment when they come in and out of everybody's rooms, which is what they've had to do for the last couple weeks. Put on all new PPE as they move between rooms on the floors. So it's an enormous burden, and it burns through a lot of PPE, and it's very uncomfortable. Thankfully, because the situation's improved, we now only have 2 wings, 2 hallways where that needs to continue, and that is good news. Just to be clear, Parsons Health Center remains closed to visitation and to all of us, except for the essential care staff that need to be on the floor. Lifting this isolation on all but those 2 wings is a positive step in the right direction, and one we're really thankful. And so let me just tell you, the 2 units, or 2 wings that remain in strict quarantine, where staff need to continue to wear all the precautions, are 1 North, first floor Parsons North, and second floor Parsons North. Those 2 floors remain in that strictest form of quarantine because on first floor we had a staff member test positive last week from that floor, which puts that unit in quarantine. And 2 North is where is a COVID unit where we continue to have a number of residents who still remain with COVID. Just to be clear again, Parsons remains closed to visitation, along with all the other areas on campus at this point. Other good news that we'd like to share is that many of our residents and our staff who tested positive earlier in November are now recovered or are reaching the end of their quarantine periods in the coming days. So we've seen a large number of staff come back to work. We're super thankful to see them back, and they're all doing well. And we've got a number of residents who've now reached the end of their quarantine period in Parsons and have moved back to their residence, which is really also really good news. Last week, we were able to close the pavilion positive COVID-19 unit in the pavilion area, and so now we only have positive residents in Parsons residing on the second floor of 2 North. So that's all good news. It makes it much easier for the healthcare staff to manage. It's easier on staffing, and it's good news. Residents are recovering, and that's good news. So now let me share with you some of the ongoing challenges. Since the beginning of November, we've had 31 residents test positive for COVID-19. 5 residents who tested positive remain on the COVID-19 unit on the second floor in Parsons. 4 residents of Westminster Canterbury are currently being cared for at the hospital. We have 3 residents in independent living that are asymptomatic and are in isolation in their independent living apartments. And then it is with a very heavy heart that I share that 5 residents have passed away due to COVID since this outbreak. Several of these residents were receiving hospice care before they became infected. And so our thoughts and our prayers are with their loved ones and with their staff who cared for them. Several of our residents in the hospital and a few of the residents on 2 North remain very sick, and so I just ask that you please keep them in your ongoing prayers. The situation in independent living remains challenging. We had an independent living resident develop symptoms and then was subsequently tested with a rapid test this past Sunday, and this resident tested positive. That resident was a Tower resident. The resident is currently in the hospital. It is not clear to us at this point how the resident was exposed or where the resident was exposed. And after contact tracing, it has been determined that a number of other residents and staff members were exposed and are now in quarantine. And it just really emphasizes the point that you need to keep your distance from each other on campus and not socialize. The residents who were exposed were in this resident's apartment without masks, at least some of them. And that's just a situation we can't put ourselves, any of us, in. Because we just don't know who has been exposed and who might be infected. And we just can't assume that just because someone doesn't out much, they haven't been exposed. It's entirely possible. So for residents in quarantine, and there are a good number of residents in independent living and in assisted living that are currently in quarantine, if you have questions about your quarantine period, please contact either the clinic or your social worker, because the duration, there's been some confusion about the duration of quarantine periods, and to make the situation worse, there's been some inconsistency provided to both us and to residents from Virginia Department of Health about that guidance. So if you have questions, call your social worker or call the clinic, and let's get it clear. In summary, basically, depending on the resident's health status, the quarantine period is either going to be 14 days or 20 days from the test date. And from a couple of different sources, residents have heard 10 days. And 10 days is not a good, for our resident population and our staff population, 10 days, it's not a quarantine period that we use. So now let me shift gears a little bit and tell you a little bit about our employee situation. Since the beginning of November, we've had 30 employees who've tested positive for COVID-19. Our newest case is a staff member who tested positive yesterday. Thankfully, many of our staff members have recovered or never showed any symptoms and have made their way now out of isolation and are back to work. And both yesterday and today, we saw a good number of staff back, and that's really good news. 8 staff members continue to recover at home. 8 of the 30 are still at home. 15 other staff are currently at home in quarantine due to either an exposure or they're awaiting test results because they've either been exposed or had symptoms. And so it's improving. It's still, we got a ways to go, and we're continuing to see new cases every couple days. So we need to continue to abide by the core principles of infection prevention and take care of ourselves and the people around us. We're really happy to have some good news to share, but it by no means we are out of the woods. There is a lot of talk about a vaccine coming to us in the next month or so, but this does not mean that the risk will go away quickly. We should expect to see more cases and perhaps more outbreaks over the holidays. The virus is very prevalent in the broader community, and the holidays are going to make it worse. You're hearing that on the news, and we're seeing it in our experience here. As I said, our most recent positive cases have just come in the past 2 days, so it is likely we're going to continue to see more residents and staff test positive. We got to all continue to be vigilant. Many of our independent living residents and assisted living residents are in quarantine right now because they've been exposed to someone who's tested positive, or because a resident leaves campus to go on a leave of absence, or in assisted living, if they go off campus for anything other than a medical appointment, they're going to need to quarantine. So we're strongly discouraging any visitation between residents in each other's apartments. As I said earlier, a number of residents have been exposed to an infected resident by being in that resident's apartment, and that's just this past weekend. So it's really important that we really limit that. And if you need to be with others, please continue to wear a mask and keep your distance. If you go off campus to see family and you get exposed, or if one of your friends here on campus tests positive and you've been exposed to them, you will need you will be required to quarantine. These are guidelines from Virginia Department of Health. For assisted living and Parsons Health Center residents, if you leave campus for any reason other than medically necessary appointments, we are going to require that you quarantine for 14 days after you return. So real quickly before I finish, just a reminder, wear your mask at all times, always have it with you, and always wear it when you are around others. Wash your hands frequently and use hand sanitizer whenever you're touching anything in public. Maintain your social distance of at least 6 feet. That's the best protection, is keep your distance. Even if you're around others, just spread out and the risks are very low. If you don't feel well, stay home, call your physician or call the clinic. It's really important. We need to take all of our symptoms seriously because we don't know. And then we encourage you to stay connected by phone or internet with your families and celebrate all these holidays here on campus away from your family if possible. While we remain closed to visitation, and as you know, many of our programs and services are currently suspended, we encourage you to tune in to TV 970 and 971 and read the tales on Thursday for more information on ways that you can stay active and also stay up to date with all the upcoming virtual programming. That's it for me today. I'll be back on Thursday with more information and hopefully some other information about other programming. There's more of that to come. Next up today is Beverly Beck from the Employee Christmas Fund Committee. Have a good day. I'll talk to you on Thursday.
Good afternoon. Our Employee Christmas Fund theme this year has been Extraordinary Times Require Extraordinary Employees. How true that has been. We have exceeded our fundraising goal by a lot. Next Tuesday at 3 p.m., we will announce the total amount in the fund. What an exciting moment that will be for everyone. Extraordinary times also require extraordinary residents. In giving, you receive. That really applies to our residents. What a joy you are. You truly care about our employees. You recognize the hardships that our employees are facing in this pandemic. You honor the staff with your contributions. You have opened your hearts in your contributions and in your comments to our employees. What a privilege it has been to work with you this past year to give our employees the best Christmas ever. There are many people who have assisted in raising the ECF funds. The ECF committee, ambassadors, and the advisory committee members have worked in this most difficult time to make sure that everything was done to support the campaign and provide information to our residents regarding the ECF fund. A special thank you is due to Karen Dillon, who last year and this year worked with residents and employees in preparing weekly articles in the Tales. They were a big hit. She is also a great proofreader. The executive staff has always been most supportive to whatever the ECF committee wanted to do. Special thanks goes to Rebecca Hatch and her staff for always being so helpful in developing brochures, handouts, tales, articles, just to mention a few. Latoya Spain has been with us every step of the way, printing brochures, posters, letters, etc., sometimes on a moment's notice. She has been amazing. Deborah Mallory has been in charge of the fund accounting. She can also respond on a moment's notice to keep us informed on where we stand in the campaign. The fund has been in great hands. Emily Williamson, administrative support staff for the committee, is truly an amazing individual. She has always had the time to work in any situation that arises. I cannot leave out Scott Jonte, who found enough Nutty Buddies for our ice cream party in July. It has taken a village to make the ECF Fund run smoothly. Everybody has been extremely positive throughout this process. It has been said that there is a special relationship here at WC between the employees and the residents. That is so true. We live well because of this unique relationship. We still have till Thursday, December the 3rd, to contribute to the fund. On behalf of the ECF committees, thank you. I look forward to announcing the final fund amount on December the 8th at 3 p.m. You do not want to miss it. Thank you.
Hi, everyone, and happy December. We're all so excited to be able to share this holiday season with you. And although this year is going to be different than years past, we're going to be doing our best to make it as special as we can. You all should have received your chocolate advent calendars yesterday, so hopefully that's going to be a fun way to tiptoe into the Christmas season, one piece of chocolate at a time. Additionally, we're starting to deck the halls. The trees are going up and they're starting to get decorated with lights and balls and ornaments of all kinds. And for those of you who aren't able to get out and see the trees, we're going to be taking pictures of them so we can post them for you to enjoy, even if it's from the comfort of your own room. The nativities are also going up, so we'll plan on taking pictures of those for you as well. Additionally, the Christmas elves will be hard at work tomorrow, hanging wreaths and greenery all on the exterior of campus. So that will be beautiful for everyone. And you may have noticed an abundance of lights outside this year. Kathleen and her team have done a wonderful job making sure everything is as bright and festive as it can be. So if you can, peer out of your windows and check out the evening lights or go for a stroll to see them in person, because it's something you'll definitely not want to miss. Also, for those of you who are strolling through the halls, you'll notice the sweet sound of Christmas music playing in them. That's there for everyone to enjoy. And holiday programming will soon be integrated into TV 970 and throughout campus, so stay tuned for that. And just please know we're wishing you all a very Merry Christmas, and we're excited to be celebrating with you. Happy December! Up next is David Curtis.
Good afternoon. I'm David Curtis with the Pastoral Care Office here at Westminster Canterbury, and a few programming notes from our office. You will find the Living into Hope Advent Calendar at the center and tower desks if you would like to pick one up. This calendar provides daily suggestions on how to mark this season of Advent, a season of hope and of waiting and of expectation. Some daily suggestions are very simple. Things like sit in the sunshine and pray for those with COVID and do something joyful today. The Living into Hope calendar is also found on the back page of the December prayer booklet. This daily prayer booklet provides a rhythm of prayer during the week, and each day focuses on a different need, and each day includes prayer and scripture. If you have requested one previously, the new ones were placed in your box yesterday, and if you live in Avalon, these were delivered to your door. These daily prayer booklets have been part of our spiritual lives here at Westminster Canterbury since April, if I'm not mistaken, during this time of physical separation. The prayer booklet also contains the bulletins for our December worship, which includes Christmas Eve and Christmas Day. If you haven't received one in the past and you would like one, or if you're a new resident and would like one as well, please call me at extension 5179 or Vanessa Perry at extension 1502. And speaking of worship, please join us this Thursday at 10:30 a.m. on TV 970 for our weekly service. Mrs. Leanne Ring, our pastoral care intern, will preach. Today's scripture reading is taken from Isaiah, but is arranged by Handel. It is the scripture used from my favorite recitative in The Messiah. O thou that tellest good tidings to Zion, get thee up into the high mountain. O thou that tellest good tidings unto Jerusalem, lift up thy voice with strength. Lift it up. Be not afraid. Say unto the cities of Judah, behold your God. Arise, shine, for thy light is come, and the glory of the Lord is risen upon thee. The word of the Lord, thanks be to God. I remember the first time I ever heard that portion of the Messiah, and for some reason it just resonated so deeply with me. And I think the reason why it did is because that section of Scripture is so very hopeful, and it is defiant, and it is expectant, and it is courageous. And if there was ever a time in my life that I need those things, it is now. These words are taking on a new meaning for me this year. In the midst of this pandemic, may we all say to one another as we lift up our voices to proclaim, be not afraid. In the midst of longer nights, may we too know such love that says, arise and shine, for thy light has come. And may our own lights shine in the dark places and during these dark nights, so that we too can proclaim good tidings to Zion and to Jerusalem and to the world. I offer you this Celtic blessing for light. May the blessing of light be on you, light without and light within. May the blessed sunlight shine on you and warm your heart till it glows like a giant, great peat fire, so that the stranger may come and warm himself at it, and also a friend. And may the light shine out of the two eyes of you like a candle set in the windows of a house, bidding the wanderer to come in out of the storm. Thank you for joining us today, and please join us on Thursday at 3 p.m. for our next video update.